Welcome back. We're here again. We're going to talk a little bit more about one of my favorite subjects, menopause. And if you're joining for the first time, my name is Dr. Ivy Branin. I'm a New York-based naturopathic doctor, and I love talking all about women's health and hormones. And if you like this video, don't forget to like it. And also don't forget to subscribe to my YouTube channel because I would hate for you to miss all the exciting content I have coming your way. And today we're going to talk not just about menopause, but we're also going to talk about how menopause can be affecting your sex life. So first, kind of a rehash again, what is menopause? So basically menopause is when you have gone more than 1 year without getting a period, meaning without having a period, which is a result of ovulation. Because there are some women that could actually be in menopause, but they might be on birth control pills, and that actually would still have you have a monthly bleed, but you technically would be in menopause. Most women do go through menopause in their mid to late 40s to early 50s, though there are unfortunately some women that will go through menopause earlier. In that case, we usually call that premature ovarian failure. And sometimes this can also be the result of chemotherapy as well. And basically what's happening is that we go through menopause because unlike men, we only have a set amount of eggs, and it comes to a point where we no longer have eggs. If we don't have eggs, we stop ovulating, and if we stop ovulating, we stop having a period. And when we think about menopause, we often are just worried. Many women actually are very relieved to no longer have a period, but they don't like all the other symptoms that coincide with going through menopause. And today we're just going to focus on how menopause affects sex, and also why is it that women who have gone through menopause, why do they experience more painful sex? So one of the main reasons is loss in hormones, and I'm going to talk about some of the main hormones that are associated with sexual symptoms. So first, estrogen. So estrogen dramatically drops during menopause, and when estrogen drops, you're going to have vaginal dryness, you're going to have poor distension, a decrease in glycogen. So glycogen is basically sort of a linking of our tissues, also a narrowing of the vaginal canal. And lastly, and it's like I feel like I'm bringing this up all the time, is a change in vaginal flora, which I talked a little bit about in the previous menopause video, as well as my video on urinary tract infections. Testosterone also decreases during menopause. Testosterone really, really important, again, for vaginal dryness, for maintaining healthy epithelium, basically healthy vaginal lining. Also helps to stimulate nerves, and it's very responsible for libido, desire, and arousal. And lastly is DHEA. So DHEA is sort of more of our parent hormone. DHEA gets converted over to testosterone, which then gets converted over to estrogen, but it itself does have an impact on sexual function. So one with desire, arousal, orgasm, and preventing vaginal dryness. There's two different forms, mostly produced in the adrenal glands, but it also is produced in the ovaries. You might have been thinking, wait, did you forget about progesterone? Well, though yes, progesterone does drop dramatically during menopause, actually progesterone actually doesn't have that much impact when it comes to sexual function. So the decline in progesterone is not so much a factor as is estrogen, testosterone, and DHEA. So what are some of the ways that you can prevent painful sex? Well, first is understanding how sexual arousal works. So back in the 1960s, when they were studying sexual response, it became very popular, this idea of a linear pattern, that one would be like have a sexual thought in their mind, become aroused, engage in the sexual desire, and then relax. Unfortunately, that didn't necessarily match the experience of most women, and that women have more of what we call a circular sexual response, that it's not that spontaneous sexual desire does not always happen. And so some of the key things that are important when it comes to sexual desire in women are emotional closeness, bonding, physical pleasure, validation of attractiveness, comforting partner, and then even responding to a partner's sexual desire. So some of the key elements are seduction, sensation, surrender, and then reflection. So why that's important is that just because you might not spontaneously have a sexual thought in your mind, where your partner may, there actually might not necessarily be something wrong at all, but a lot of this is that some of these things really need to be cultivated. So, and one of the other key factors specifically when it comes to women and sexuality is this idea of novelty. And some women going through menopause, they might be with their partner 15, 20, 30 years. So a lot of that novelty has also decreased, and that can actually have an impact on sexual function. I'm not saying that you need to have an affair, but it might be time to literally spice things up, specifically if sex has become a routine. Other things are also important that as you know, after menopause, arousal can take longer, and so maybe you need to put a little bit more work in it, via touch, via whatever, you know, gets your juices flowing. And again, you know, maybe again taking a little bit more time. And the other thing is making sure to schedule time for sex, plus also using things like vibrators can be really helpful as well, and any other ways of stimulation. So some of the other things that are really kind of also important when it comes to preventing painful sex, actually sleep is really, really important. So without adequate sleep, we're gonna have more oxidative stress and more stress in general, and that's gonna impact sleep. Mindfulness and mindfulness stress reduction also really, really important for enjoying sex and feeling sexual desire. Exercise, which I mentioned a lot in previous videos, but exercise also very important for pelvic floor, stimulating testosterone, oxytocin, which is like our bonding hormone, pelvic circulation. So really, really important. And actually studies have shown that couples that exercise together, better together. Probiotics, again, Lactobacillus rhamnosus, Lactobacillus reuteri, definitely going to be your best friend, specifically post-menopause, because they drop. And most women, once they've hit menopause, because they're not afraid to get pregnant, they might engage in sexual activities that they didn't before, and that can definitely also disrupt vaginal flora. So really important to build up your defenses with Lactobacillus rhamnosus and Lactobacillus reuteri, so you don't get a urinary tract infection or bacterial vaginosis. Vitamin E, specifically vitamin E suppositories. Definitely, if you're using vitamin E suppositories, want to use that away from sex, and I think that kind of makes sense, and I don't know if I have to like explain that so much. And then lastly, L-arginine, which I also mentioned in a previous video on sexual arousal and menopause. So what are some of the natural treatments for painful sex during menopause? So definitely looking at our aphrodisiac herbs. So what does that even mean? So they're either substances that cause vasodilation through nitric oxide, which basically causes erection, so both like in a male, but also female by helping to bring more blood to the clitoris. They also enhance sexual pleasure, and then lastly, enhancing libido. So some of my favorite aphrodisiac herbs, I mentioned one in actually both previous menopause videos because I feel like it's like the best like menopause herb, maca, specifically the gelatinized maca. So this maca is an adaptogen. We also call it Peruvian ginseng. Sometimes they call it female, like natural female Viagra, but it can be very, very helpful. Also just regular ginseng or Korean ginseng. So these are some of the aphrodisiac herbs that I often recommend. Also Demiana, Tribulus. There's a lot of different herbs that can be really, really helpful. So as a naturopath, I also can help with guiding through the sexual changes associated with menopause. I didn't get into it as much, but also there's so many different like dietary changes that can really, really help if you're going through menopause. I did mention in the previous video the importance of the Mediterranean diet, and even the Mediterranean diet itself has also been shown to help with sexual function. So again, if you liked this video, don't forget to like it, and also don't forget to subscribe to my YouTube channel for so much of the exciting content. And looking forward to seeing you again. Again, my name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City. Have a wonderful day.